Hello, everyone, and welcome back to another episode of Parenting is Easy, said no one ever. I am your host, Hananya Abraham, and I have a guest today, Dr. Gary, who is going to teach us and give us some guidance regarding dentistry and pediatric dentistry and how we can help our kids, both for themselves and as for us as parents. There's a little bit about Dr. Gary, and we'll get right into the interview. Dr. Gary is a pediatric dentist based in the Los Angeles and Orange County areas. He is known for his friendly, light-hearted personality, and he earned his dental degree from Western University of Health and Sciences in California in 2018 and completed his pediatric dentistry from the prestigious University of Southern California in 2020. He, along with his partner, Dr. Junyi, have a practice that is based in, is it Pomona area?
Irvine, California.
In Irvine, California. And they both are at the forefront of their respective fields, who are friendly, talented, and top-rated doctors. And they incorporate new technologies with mental health practices, as well as set apart their pediatric dentistry in our nation in general, creating an environment that are both welcoming to their patients, family-friendly, and potential place of healing for all. One of the things that stood out to me from when you guys were introduced to me was the concept of you guys are building a business of kindness. And what came to mind for me, and we'd love to start here, is when you look at any sort of packaging for a food product, you can tell the amount of what is by the first ingredient that there. So if you're dealing with a cereal and you see wheat as the first ingredient, it's majority going to be wheat with like a few other things. And here you guys are starting a practice of dentistry, and the first order of business is kindness, which I think says a lot about what you guys are offering in your practice. How does that incorporate, and what is the foundation of the practice in general with dentistry and specifically pediatric dentistry when it comes to dealing with children?
First of all, I love that you know about ingredient lists and that the first ingredient is the majority. I love that. But yeah, I think our practice is kind of modeled after something that me and Dr. Juni kind of just believe in at the core of like what it means to be human. And it's just to be kind to other people. It's kind of weird to say that we have to like mention that we should be kind towards others. Right. But I think a lot of stigma and anxiety around dentistry is like, oh, they just sit you down in this ugly office and they just like force something in your mouth. You feel uncomfortable. You feel like you're not heard. You're not seen, that the doctor kind of runs everything. We wanted to kind of start a practice that's kind of like a little bit different, where when you go see your doctor, your dentist, you feel like it's an open conversation, somewhere where you feel like you're respected, that you're heard, you're seen, your kids feel safe. That's why we kind of chose, it sounds kind of tacky like when I say it, but it's just called Kind Smiles. I think a lot of dental names in general can be very like tacky and cheesy, but I don't know, we just wanted to keep it simple, like Kind Smiles.
I love that. And I think that you're making it a collaborative approach. It's not just about your expertise that you are trying to implement within the practice, but it's about bringing the parents in and obviously the children as well. That really makes the practice something that you are trying to make such an impact on what is happening within your office. And obviously even more important outside the office, because dentistry is something that, unless you're dealing with something specific, that you might be there every couple of months. And there's really the work that's happening at home with the parents and how they're structuring and giving over information to their kids regarding their hygiene, regarding their teeth, that is so important. So what are some of those things that I guess us as parents can really be asking you? Or what type of questions would you like us to be asking when we first meet with you?
I guess it depends on like what age your kids are. But I think one of the biggest things for new parents that they come in, they ask is, when should I see the dentist? I think we have even some older parents too. They're like, oh, when should the kids see the dentist? We like to recommend when they get their first tooth and then by age 1 year old. And then a lot of times parents think like, oh man, they don't even have teeth at that time. Like they have like a couple teeth. Why should I come in? When the kids come a little bit early, they get more comfortable being at the dentist, even if the first couple appointments is a little bit rougher, but they do kind of get used to the idea of like, oh, we have to take care of our teeth. Oh, this is important to kind of be mindful about what we eat. And then it's also a good opportunity to talk with the parents. I think that's the most important part. And then teach them things like, oh, we shouldn't leave our kids with milk at night because the milk sitting on the teeth can cause baby bottle rot and decay. We shouldn't be frequently giving our kids sugary snacks because that can cause cavities. We should try to get rid of thumb sucking as early as possible so we don't create arch changes in the upper palate. Tongue ties. Tongue ties is a big thing that we talk about too. Like, does my kid have feeding problems? Can they speak properly? Like, we can diagnose these things early and they kind of catch it before it causes a lifetime
I
of
love that.
problems.
I think that there's so much information that we don't even realize that can give us. You're talking about, which is for me the first time I'm hearing this, maybe talk about this a little bit more regarding speech impediments that might come up just based on the shape of the mouth, the structure, or the muscles or lack thereof in the tongue and the lips. What are some of the signs that parents can look at or look out for when it comes to things like that to even bring up to you in the first place?
Yeah, some symptoms that we kind of look out for would be like, does he have a lisp? Does your child have difficulty saying certain words? Are they a little bit delayed in terms of their speech? Like, do a lot of the other kids, are they able to say whole words, but our kid isn't able to say certain words or make certain sounds? Another thing to look out for is if they're picky eaters. Like they don't like certain types of foods that are too sticky or maybe something that's too crunchy, because if the tongue is being tied down to the mouth, they have a hard time moving it to kind of control where they bite. So it's interesting to think about like how this tongue that we think of like that we can just use every day can cause problems like that.
Yeah. Oh, for sure. There are so many things that as parents, we don't even realize might be happening behind closed doors, so to speak, that I think just having that little bit of knowledge regarding whether it's the foods that they eat or the things that they don't like eating, picky eating is not just about the flavoring, but it's about what's happening inside the mouth as well. And I think one of the things that I also liked about hearing about your practice is the incorporating of mental health when it comes to teeth. I'm curious if you could talk about that a little bit, just the importance of the mental health part. And I'm speaking as both a parent and as a psychotherapist here, just to sort of hear from you the importance of the mental health being incorporated in dentistry and us as parents dealing with our kids' teeth.
Yeah, I would say mental health these days is like such a big issue. And then when kids come to the dentist, even when parents come to the dentist, they tend to feel like certain anxieties around it. They don't feel like the dentist is listening, or they feel like it's a scary place. So in terms of that aspect of it, we try to keep the clinical environment, the patient doctor interaction kind of very open, very free, very fun, just so that patients and parents can feel like this is a safe space for them to ask questions or kind of learn about something new. But in terms of like what we do with our patients, we try to empower them as much as possible. We want them to feel like they have a sense of control, that when they are taking care of their health, taking care of their teeth, even just living life, that they're able to kind of tackle that with a confidence. And then Dr. Junie, she's the orthodontist in the office. So she works in the realm of making teeth straight so they can be healthy, but also to empower kids to look good, right? Because if they feel good about how they look, they can do good in the world. That's kind of how we think. So it kind of starts from like inside, and then we kind of try to like nurture this confidence, nurture this healthy environment where the patients and the parents can kind of choose their own adventure. What do they want to learn in their practice? How do they want to do it? How do they want their oral health to look like
I love that.
in years like down the road?
So let's say for people that are not coming to your office, what would you recommend they think about asking their dentist or orthodontist regarding creating that autonomy where the parents and the child has more control over their dentistry as opposed to it just being in the hands of the doctor?
Well, I guess it depends on what you're trying to accomplish. Sometimes with the younger population, the parents are more focused on how do I best take care of my child's teeth? So then it's good to ask about different brushing techniques, different like tools that we can use, different toothpaste, toothbrushes, different, I would say, adjunct devices that can help us take care of our kids' teeth, maybe different techniques that we can do to kind of make brushing better at home. Watching a movie, for example, or even asking just your dentist, seeing what they think. Because I would say that when I talk to other pediatric dentists and even other orthodontists, everyone does things a little bit different. And I'm always learning like new techniques from my friends and from online and Facebook and Instagram. So it's good to kind of pick your doctor's brain just about what they think. But I would say like nowadays more than ever, it's really important to advocate for yourself and advocate for your kids. So asking just as much questions as you can about what you can do at home and what you can do to prevent problems, that I think is the key for parents these days.
I love it. I love it. That makes so much sense. So I just want to pick your brain a little bit more on that over here.
Yeah.
When you talk about different techniques when it comes to brushing, or maybe even style of toothbrushes or toothpaste, and maybe this is a three-part question. Are there things that you would recommend for parents to either be doing at home or maybe even asking their dentist about what they should be doing?
Sometimes dentists are curious about fluoride use, and then fluoride use for younger kids, especially when they get their first tooth, we do recommend just a little bit of fluoride. a rice grain size where they can practice using the toothpaste, get used to the flavors, but also get the anti-cavity properties of the fluoride. Let's see. Other things to recommend to do at home, right? Making brushing fun, right? So we can kind of tell stories. We can use YouTube videos. One thing we teach at our practice is positioning of the patient. So parents should always brush the kids' teeth all the way up until age 8. Sometimes parents are like, oh my God, that's so late. But the kids don't have the dexterity to really do a good job brushing. But the positioning of the patient really helps us or helps the parents brush. So lying the kids down with their head in your lap, kind of like when you visit the dentist, and you're able to do a lot better brushing job in that sense. One kind of tip that I think I was like learned from a lot of the parents is that you don't need a brush in the bathroom. Everyone thinks that you have to brush your teeth in the bathroom, but you can actually brush in the living room, in the kitchen, outside when the kids are playing, especially when you start brushing without toothpaste. You can just do a dry brush just to make sure to get all the plaque off, all the food out of the mouth, and then they can finish it maybe later with a little bit of toothpaste. So changing the environment where you do the brushing can also help outcomes too. One of the big things too is thinking about the diet. I think diet and dentistry is very important because we know that so much of our American diets have so much sugar and added sugars in it. So we really have to be careful about kind of like what we're feeding our kids, because even like a little piece of candy we think is really small, but then to a child that's, I don't know, like 3 feet tall, that sugar is a lot for their body. Kind of just like reframing how we think about dentistry and like taking care of our teeth and then doing it in a more like palatable, fun way, I think is the way to go for most parents.
Yeah, I think that positive association, it's not just about homework or, about hygiene regarding the body, but even regarding the mouth as well. You made me think of like my 2-year-old and feeling left out when his 2 older sisters are brushing their teeth. And he's like, hey, I want to be a part of this. So just getting him a toothbrush so he can be there with them and say, hey, I'm a part of this and I'm doing this too. That's, creates that mentality. Like before we go to bed or before we leave in the morning, this is what we do. I think something else that I was thinking about that, came up when you talk about positive association and trying to create an environment where it's not a scary place going to the dentist, like you were talking about before a little bit, is when you have that child on your lap, which I never even thought about. So I thought it's a really good idea. And you're brushing teeth for them. It's sort of creating that same exact atmosphere of when you go to the doctor, when you go to the dentist, and you're in that same position. And it's not a scary position. And the same way, mommy, daddy is here to help you brush your teeth. Now we're going to go to a professional that's going to work on your teeth and make sure that we're doing a good job at home. So it's creating that same type of physical atmosphere in that position at home that you're also going to be doing in the doctor's office, which I thought was an absolute awesome idea. I love that.
Yeah. Have you ever used the electric toothbrush like for your kids?
Yeah. So one of my kids, it was like a prize that they won. So they happened to get an electric toothbrush.
Yeah.
One of them did not want it. She said that she much prefers to use her hand motions. Is there something that is recommended or how it should be done properly?
Yeah. I mean, in general, a toothbrush is a toothbrush and they both do a great job. When the kids come to the office, they might start just with a regular, like we might brush our teeth just with a regular brush just to kind of get them used to it. But then sometimes the kids are actually afraid of the spinning brush they use to clean your teeth. So sometimes we might tell parents is try to get electric toothbrush just to practice at home. They can get used to that spinning like feeling, and then it can kind of get them used to it, get them desensitized to the brushes that we use in the clinic. But this is really good for kids with sensory issues because they kind of thrive on routine and need some type of predictability.
Oh, that's great.
Practicing something at home regularly
good,
can make things in the office a little bit easier.
And I guess really every single kid is different, and a parent should be curious about knowing what's happening with that kid, with their oral hygiene, to know what they should be doing. And you can have 2 kids that are close in age or even are in age, but depending on what that kid might be into or what that kid might want or what one kid might have a sensory issue is different. And every parent should be aware of that. I think that's very important. Now, let's say when it comes to flossing, what would be the proper age for that and how often? And are there certain techniques that we should be using as parents?
Yeah. Oh man, you're going to hate my answers. All the parents hate the answers. So when they get their first teeth, typically around 6 months, most kids will have a lot of spaces between the teeth. So if they do have spaces, we don't need to worry about flossing those teeth as much. But if they don't have spaces and the teeth are touching and they're very close, we have to floss those teeth. So parents will say like, oh my God, it's so hard just to even brush their teeth, right? There's different techniques that we can use to kind of help out with that. The positioning is really important, where when the kid's lying backwards and you can look down into the mouth, this helps a lot. Other position, other things that could help is using a floss stick, right? Instead of the floss strings. The pick is a little bit easier because you can kind of hold on to the handle and then you can go back in the mouth. But the string is going to be a little bit better because it curves and hugs the tooth. Honestly, like any flossing is better than no flossing. The good thing is we don't usually recommend flossing like 2 or 3 times a day. Once at night before bed is usually enough to kind of prevent cavities from growing between the teeth. Other things that might help too is if you're flossing the kids, the little floss stick, and they're biting down, right? They're just chewing on that thing. You can use the back end of a toothbrush and then you can have them bite on it. And then you can do the flossing and then switch sides. They bite on it and you floss that side.
Got it. That's really cool. It's sort of like, when you're putting in the wedge in the mouth to keep the mouth open, it's our home version of doing something like that. Talking about the spaces in between teeth, what are some of the most interesting things that you found in between children's teeth that you've had to pull out?
Oh my God. I mean, we found some gross things like hair. I don't know, hair gets in there somehow. I've seen, what are those things called? Like, those little beads that people have on bracelets?
Oh, wow.
Yeah,
my gosh.
Yeah,
what are some of
those bead things? Like I've seen them wedged on the teeth before.
Oh, man.
Kids get into some crazy stuff.
Wow. What are some of the
fingernails?
Best excuses kids have given for not flossing or brushing their teeth?
Let's see. It's interesting because the most common one, like all the kids say this, is, oh, we don't have floss at home. They always say that for some reason. And then the parents, I look to them and then they're just like, we have floss. We have floss at home. I don't know why they say that. Sometimes they say like, oh, I only floss when popcorn gets stuck in my teeth. Right. If something feels stuck, then they want to floss that. But then we just tell them you have to floss every day because things get stuck even though if you don't feel it. Right. But yeah, I think kids and adults in general, they just don't really like flossing in general.
Guilty, 100%. Yeah. So I think something that I learned in one of my trainings was she was telling us about how much she hates flossing. And she said, when you have, like you were talking about before, positive association, that can really change what it is that you need to do as opposed to hating to do it. The example that she gave was that she loves taking morning showers. And what she did was she took a whole packet of the single-use picks, floss picks, and she attached it to her soap bottle. Now, every time she was in the shower, she would use one of those, which made her say, hey, here's the thing that I like doing, showering. Let me attach something that I don't like doing. And it sort of made it that, well, now I got to do it every single day. So when a parent creates that environment of, oh, okay, so there's a certain game that you like playing on the tablet. Okay, so while you are flossing, you can play that game. It sort of creates that environment where a child not only is like, oh, I don't want to do that now. It's more like, no, I want to do that so that I could play my game. Maybe that's something that, people can listen to. But I think hopefully one of the things that people are really hearing in this is it's not just about, well, these are things we're supposed to be doing, but it's about creating an environment where we want to invite conversation, where we want to invite curiosity. We want to invite it to be something that it's not just a chore, but it becomes something that becomes part of our routine, like we're saying before. And I'm sure you use your words very, very carefully, talking about it's not that there should be no sweets, but there should be limited sweets. And there should be a way that we're going to be talking to our kids that is so important when it comes to their health in general. Are there things that I guess us parents in general are not necessarily aware of for the most part when it comes to our kids' health? Not just regarding the hygiene, even just regarding the future of our kids' teeth and their bite and their shape of their palate, that we should be aware of now when we have young kids, that by us taking care of it now, that will dramatically have a positive effect as our kids get older.
Oh man. So there's this thing called interceptive orthodontics where you kind of do braces a little bit earlier than teenage years, right? Where the kids are really young. And then the idea of interceptive orthodontics is to get into the mouth, correct any changes so it doesn't cause problems later. Some of these problems would be like smaller jaw, smaller arch. And then one interesting finding is that smaller jaws and then tight tongues can also cause breathing problems. So if your kid is snoring at night, maybe has large tonsils, one of the questions I ask is, do they have tongue tie or do they have a smaller jaw or smaller arch? We find that kids that have breathing problems can actually have focus difficulties in school. So a lot of kids, we might think that they have ADHD. They're hyperactive, they can't focus. Turns out they actually aren't sleeping at night. They have a maybe undiagnosed sleep apnea where they're just waking up every so often and they're just waking up tired. As an adult, we would exhibit these symptoms as, oh, we're really tired, I'm exhausted. But as a kid, as a child, your symptoms are almost opposite. you're like very hyper, you're very active. So that's something where if you you do treatment earlier, you can actually widen the jaw. You can create more space for the tongue.
Wow.
So then it can rest naturally and more healthy. And then the upper jaw is actually the floor of the nose. So then you can actually get better breathing into the lungs.
Wow.
So
Wow.
that's one of the things where early treatment for this can really change somebody's life.
Wow. Not something I ever would have thought of, but when you think about a child's breathing and how the effect that could have on their later on life, and thinking about how the dentistry comes into play for that, I think it's something that I never would have thought about. Are there certain things that, let's say, kids bring up, like if this is hurting me, or I don't like we were talking about before, the sensory of food, that should be not necessarily raising an alarm, but raising a curiosity or a awareness when it comes to different things that our kids might say, like regarding, oh, I always have a stuffy nose, or I'm constantly sneezing, or when I have the crust of my pizza, it hurts on this side of the mouth. Are there certain things that we could be looking out for as parents regarding the sensory aspect of things that we should be or could be bringing up the next time we go to the dentist?
Yeah, let's see. In terms of sensory things, I would say one of the things that we see like pretty frequently is if snoring. Like snoring is a big thing. If you notice that the kids are snoring a lot at night, if they are mouth breathers, right? So they're constantly just stuffy nose, mouth breathing all the time. That can kind of raise some questions. If they have bad breath, so mouth breathing will dry out the mouth. Sometimes parents will say, my kid's breath always smells really bad. Doesn't smell really good. Even when we brush our teeth all the time, it smells really bad. That's a kind of symptom that we might see related to that. Even the way they smile, like just, their smile looks a little bit off. It looks a little bit crooked, or their teeth are kind of in weird position. Like that is kind of a thing that would be something to ask your dentist to check. In terms of like food habits, it's tough to really kind of narrow in on as particular like soft foods or hard foods, because even healthy kids just have different like preferences in terms of like what they like and their texture preferences. So I can't really like say like crunchy or hard foods per se, but if they're very picky and they only want to eat one thing, something to bring up with your dentist as well. It's for them to check out if there's anything going on in there. One thing is if they like to eat on one side more than the other, they're always like chewing on this side. That's something to bring up with your dentist too. Maybe there's a cavity in there that's causing them to eat on the other side. Maybe there's a bite problem that one side is touching, the other side is not touching, and this needs to get corrected in order for them to have a balanced bite. So there's just a few things.
Yeah, that makes a lot of sense. Are there certain things that we should be asking about at certain ages when it comes to my child possibly needing braces? Is there a certain age where we should start thinking about this topic, this very expensive but yet very needed topic?
Yeah, I think around age 7 is kind of should be thinking about it. Age 7 is usually when the orthodontist will just like to get a check-in. Just, take the kid to the orthodontist to see if they need braces. As a pediatric dentist, we're kind of always kind of looking out for these problems. But I think 7 years old is kind of an age to think about braces, because if they are going to do any early treatment that involves changing the jaw structure or maybe the jaw relationships of the teeth, 7 to 10 is kind of the ideal age because the bones are a little bit softer. So then you can actually widen the jaws instead of having to do surgery where you have to break the jaws instead.
Right. Okay, that makes a lot of sense. What type of questions should parents be asking their dentist about inquiring when it comes to braces? I remember saying with my oldest was, I don't even know what it is that I don't know when it comes to braces. So what are some of the things that we should be looking out for or asking? Okay.
Oh man, in terms of braces, I mean, usually I think a good opening question is like, do my kids need braces? Just to start the conversation, right? It's like, do my kids need braces? It then opens up the conversation where the dentist and, the patients, they can talk about, oh, what do we see? Do we see crooked teeth? Do we see like smaller jaws? Do we see a bite problem? Is it more aesthetic? So then that kind of opens up questions to, what type of braces does my kid need? Do they need just regular bracket braces? Do they want Invisalign, like the invisible clear aligner braces? Do they need an expander where it widens the jaw? Do they need surgery later? Do they need headgear? Like Ugly Betty headgear where they can fix the positions of the jaws this way. Then it becomes a question of, can the kid tolerate braces? Like, do they have good brushing habits? Do they have the discipline to wear the Invisalign trays every single day and not throw it away in a napkin? A good question for parents to open up with is, what do you think about my kid needing braces?
I like that.
Just a really easy one. And then that kind of can start it.
I think that's a great conversation starter, at least by the dentist
Yeah.
office. I think that could be really, really helpful. So now I'm curious then regarding when a child is there in the room and there is some sort of discussion regarding a treatment, whether it's cavities filled, some restructuring or braces. And sometimes, or I would say, can't speak for everyone, but I would say for most of my kids, there's always a situation of there's an anxiety that pops up from that kid that's sitting there in the chair. How would you work with a child that's having, let's call it mouth and anxiety, when they're sitting in the chair?
Yeah. I think different parents like to kind of like guide the way that the kids deal with it, right? So sometimes the parents, if it's a more serious thing, like that they're worried the child is like very worried about, then we might have the child like leave the room, or we might talk with the parents in another room and then let the parents kind of discuss this at home on their own terms. Another way we might talk, let's say the parent wants us to talk about it with the child in the room and then everybody just wants to be part of the conversation, then we'll change the language that we describe things. So for example, we don't do this a lot with braces because braces are the kids are a little bit older and the parents are usually making those decisions most of the time. We do this a lot for like cavities. We like to change the language with kids because we don't want to say like, hey, we're going to drill in your teeth and then give you a shot. Like,
I like that.
That type of language scares anybody. So then we say things like, oh, hey, you have some sugar bugs that are living in your teeth. And today we have to put those sugar bugs to sleep. We're going to use our sleepy water, our sleepy juice. And once we brush the sugar bugs out, we're going to do a sticker for your teeth. What kind of sticker do you want? We can tell a story about the sticker. We can kind of customize things. If they need a crown, we'll say things like, oh, we're going to give you an Iron Man tooth or a princess crown. If they need to get an extraction, God forbid, right? We can say like, oh, we're going to out one of your teeth because it's very sick and then you're going to feel better afterwards. So I think there's different ways to kind of structure the conversation so that we can be inclusive for the kids as well. But also sometimes the parents just don't want the kids to know about this. And then that's something that they can do on their own terms as well.
Yeah. I think one of the things that, that are pretty common when it comes to parents dealing with their children's teeth and even their own teeth is the monetary part that comes about together with the investment and the overall burden that can sort of take place every time we're going to the dentist. And being that a lot of insurances don't necessarily cover it, it's usually coming out of pocket. And that could cause a stressor for the parents and sometimes in the room itself. What would be something you would recommend to parents, to us, to sort of know beforehand when it comes to dealing with the monetary side of dentistry work that is necessary and needed in most situations?
Yeah, I guess there's various patients, right? There's patients that have state health insurance. If you have state health insurance, it's important to find a provider, like a specific dentist that accepts state health insurance. And there are dentists out there. If you have just like regular health insurance that you buy, then a lot of times those insurances will have providers on their subscriber list. And then those providers will accept insurance. A lot of times you can kind of, before you go to the dental office, you can kind of see like, oh, what are the costs associated with the dental care or the exam? And then they can kind of give you an idea of like, oh, your copay will be this much, the insurance will cover this much. And then they get you an idea of that. A lot of times preventative care is covered by insurances. And then a lot of like treatment type cares will be majority covered by insurances, maybe a small out-of-pocket expense for that. But I think the biggest thing would just be to prevent cavities instead of going before it's too late, because dental treatment does cost a lot of money, but it's also totally preventable because a lot of the reasons why cavities happen can be prevented by home care, brushing, diet, things like that. So then prevention is the cheapest way of kind of doing dentistry. In terms of braces, I will say that it's important to check your insurance to see if there's orthodontic coverage. Sometimes orthodontic or braces coverage is actually like an add-on. Like you have to add that in addition to the dental insurance. So that's something to think about as well. But I will say the insurance industry just in America is insane. Like they kind of are doing their own thing. And then the patients and then even the doctors are kind of just like it's their home court and we're playing on their turf pretty much.
We are puppets for them. Yes. Very, very much so.
Yeah. But I will say even from a business or dentist perspective, we have a lot of issues with insurances as well, whether it's getting reimbursed properly or even getting the proper coverage for our patients. Like we work really hard to make sure everything's as clear as possible. But at the end of the day, if they don't want to pay something, like if the insurance doesn't want to pay something, they'll do what it takes to make it as difficult as possible for the patient and for the doctors.
Wow. Okay. I guess that's where the dentistry world
Yeah, I
and the
know.
psychotherapy world overlap in that sense a lot. You talk about preventative work, and the more we do things at home, I guess in some ways, the cheaper and the lighter on the wallet it's going to be for us. So I have one more question regarding this preventative care. When you have a child that is into sports or extracurricular outdoor activities where there's going to be high impact, what can we do as parents to help prevent any sort of mouth and teeth issues?
Oh man, I think the number one, or there's two really big topics, is for our teenage aged kids,
Okay.
they should be wearing a mouth guard, a sports guard for any like sports, like hockey, especially basketball, football, just any type of contact
Right.
sports.
Is there any specific brand that you would recommend?
I don't really recommend any particular brands, but I think there's different like routes you can go for sports mouth guards. You can make it at home with Boil and Bites. Honestly, like any brand, there's no particular brand, but those are the ones that you boil in water, you bite into it, and then it molds into your teeth. Those are good for kids. They're cheaper, and then they're good if the kids are growing because you need to change it every like few months or so. If the kids become more well established and they're more in their late teens, then getting a custom mouth guard is going to feel a lot better. It's going to be thinner. It's going to look better too. So custom one that we can make at the dental office is good. In terms of mouth guards, I think the kids should be wearing some type of mouth guard if they play sports. But the second topic is actually if they get hurt. Sometimes kids get hurt and they knock out their teeth, they damage their teeth. The biggest thing I would say is if an adult tooth, so if your kid's over 8 years old, if one of the adult front teeth comes out, you should just rinse it off very gently, hold it by the crown of the tooth, and then try to put it back in. That's the best because if the tooth stays out of the mouth for more than an hour, I would say like that tooth is almost toast. Like you just need to gonna get a root canal. Like it's gonna be a lot more problems down the road. But if you can get it in a few minutes, the prognosis increases by a lot for that tooth, where you're able to keep it, it's able to regrow the nerves of the tooth. But if you can't put it back in for whatever reason, it's intimidating or too much pain, put it in a glass of milk. Yeah, store it in a glass of milk and then go to the dentist ASAP because then they will put it back in. But that will help prolong the prognosis for the tooth by a lot.
Wow. Wow. Okay. So I guess my last question for this before I sort of turn it over to you and I do a few rapid fire questions, because I think what this last topic we're talking about here, stress and how that comes into play regarding sports, regarding academics, and the impact that that can have on our teeth. I'm curious if you could talk for a minute about what we as parents can do to assist our kids when it comes to their dental health, when it comes to stress.
So it's interesting that you bring that up because I think a lot of people have noticed since COVID happened, a lot of people, adults especially, have been breaking teeth from clenching because they've been so stressed out. Because we know that grinding and then clenching is kind of reflective of stress, like anxieties that we hold inside. I mean, besides like the dentistry part of it, I think things at home that we can do, just like regular breathing exercises, sleeping early, and then also not using devices before we sleep actually can improve a lot of our sleep habits and improve our sleep quality, which can also affect grinding and clenching and things that affect our teeth. In terms of kids, like, and how they're stressed out, I think it's tough because the world that we live in right now is just so stimulating. It's so stimulating in terms of what we see on the internet, in terms of our expectations for the kids, in terms of what it takes to like succeed and kind of like make your own path in the world. So that's really tough to comment on because every parent has their own like strategy and like route for helping their kids stress. But I would say like listening is really important, having conversations with your kid, and then also trying to change the way we think about certain things, right? Like maybe it's not like we have to do something. Like I have to do this every day. I have to exercise every day. Maybe shifting the thing, maybe the perspective of it, like, oh, I'm lucky that I get to exercise every day and just be thankful for things. That can kind of change the mentality of stress and kind of how we navigate the world. Maybe not too dental related.
At the same time, very dental related. So I think
Yeah.
that's amazing advice. And for anyone that's been listening to this podcast, he was not paid to say any of that, even though those are all things that we have talked about here. But I think there's so much information here. I think I sort of have to take a break after this, just sort of process everything. Has there been any topic when it comes to dentistry and our kids that I have not asked you about, that we have not talked about here in this podcast, that would be something that you would usually talk about?
Let me think. Let's talk about that. I think preventative guidance is really important. Honestly, I think the technology of dentistry is a very interesting topic that I really enjoy talking about, because when I started dentistry, I was under the impression that cavities needed to be drilled, cavities need to be filled, right? And then that was like the model that all dentists use. And a lot of dentists, I do that every day. But then I think as I've gone through my career and then gone to residency and like learned about pediatric dentistry, I learned that we have a lot of different techniques in our toolbox that we can use. Involve minimally invasive treatments like using silver diamine fluoride to arrest cavities so we don't have to drill them. Having extra checkups using fluoride to reduce the spread of cavities. There's a lot of new technology with like iodine and kind of remineralization using different ingredients to kind of rebuild teeth as well. Also, like using glass ionomers as a material to restore cavities instead of the composite fillings. Hall crowns is like one of the things that I've been doing, where instead of drilling the entire tooth to put the crown on, we can actually take like a silver crown and slip it over the tooth, and that covers the cavity. I mean, this is very simplified.
I'm sure.
Yeah, we've been doing a lot of these techniques to really help younger kids get over cavities and overcome cavities.
And also the anxiety when it comes with being in the office.
I mean, if we don't have to give shots and we don't have to drill on the tooth, that's a win. We also have a laser in our practice.
Oh, yeah.
Where we're able to remove the cavity without giving the shot. Like, there's all these new technologies that we can do for dentistry. Like, there's sedation dentistry where adults and kids can go to sleep, do the dental work, and then they can do like all your teeth at once. There's just a lot of things that are out in the world these days that you never know unless you just ask your dentist about, or you find the right dentist for you.
Yeah. So I think the biggest thing that I'm taking away from this is, as parents, when it comes to our kids' teeth, just like every other part of the anatomy, be curious, ask questions, and see what's out there. And there is no one size fits all. It's about doing what's right for your child. And I think that's something that I've really learned from today. As we sort of finish up over here, I have a few rapid fire questions for you just to sort of tie everything together and sort of end on a fun note over here. Would there be a book that you would recommend that parents can get more information from?
Oh, a book. Oh man, for teeth? I don't even know. I mean, one thing I've been reading recently is it's called Breathe. It's called Breathe. And I think that's a really interesting book because it talks about the science of breathing and then how we're just not breathing properly these days and how breathing can affect so many things. I forgot the author to it. But Breathe is a really interesting book. It's not made by dentists, but they actually interview a few dentists in there. But that's been changing the way I think about oxygen, carbon dioxide, and just how we breathe.
Yeah, it's by James Nestor, and it's in one of those books that's on my to-do list. So I think when I finish the books that I have, hopefully we'll get around to that, and we will post a link for that in the show notes. But that's a really good recommendation and how that could benefit what we've been talking about today, and I think overall hygiene and dental hygiene in general. Can you think of, in like one or two sentences, one of the funniest, most hysterical stories that have ever happened in a cheer of yours in the office?
Oh man. I mean, the first thing that pops to my mind is how kids can be so mean sometimes. And then sometimes they'll make fun of the assistants and be like, "You're not the doctor. Like, you should get a real job." And I'm like, oh my God, that's so mean. But I don't know. Like, kids are just so funny. I've also had instances where kids will just fart, like no shame. Like, they'll just pass gas in the chair and then we just have to deal with it in the room. I know, I love them for that. Like, go them.
Oh gosh. Oh man.
Yeah, they're brutal.
It's amazing. All right. My last question for you today, doctor. If you can think of a superpower that you would like to have dealing with everything that you deal with in the office, but it has to be a mundane superpower every day to help the kids that you deal with, or as parent in general, what would that be?
I think if I could just make anybody laugh on command, I would just do that. Yeah. I try to. Sometimes it works, sometimes it doesn't work.
I think laughter is so important. So yeah.
Yeah, you could just make people laugh.
Right. Yeah. I think that's a sign of a good comedian. They're not always on. Even the good comedians still get a blank face. But I love that. That's a really good one. I think it's the best answer I might have gotten on the podcast so far. But it's really been awesome. Dr. Gary, this has been absolutely amazing. Is there a place that people can find more information about you, about your practice, and where maybe they could get some more hygiene information? Yeah.
So we're big on social media. The practice Instagram is Kind Smiles Irvine. And my personal one is just Dr. Gary Liu. We have a website, kindsmilesirvine.com. We have Yelp, we have Google. But yeah, check us out on our website and you can find all the details there. We're in Irvine, California. Yeah.
We will post all of the links in our show notes. Gary, this has been an absolute pleasure. Thank you so much for joining us.
Yeah, thank you very much. It was awesome talking.